Why are screening mammograms so important? You know, up to 1 in 8 or even 1 in 9 women in their lifetime will get breast cancer. And so it's very important to catch that cancer as well as any cancer as early as possible, because the earlier we can catch cancers, the more likely they're going to be able to be cured. My name is Dr. Brandt Esplin. I'm an oncologist with Revere Health. Best time to start screening is somewhere between the ages of 40 and 50. Now that one's kind of controversial as to how often, but pretty much everyone agrees that around your 40th birthday is the best time to start, whether that's every 1 or 2 years, or even some groups recommend every 3 years up until the age of 50. After the age of 50, between 50 and 74, everyone pretty much in the world agrees that mammograms every 1 or 2 years are clearly recommended, and certainly the time to be consistent with screening mammograms.
It's shown that mammograms can reduce or can improve the outcomes in breast cancer, mainly because they pick up the breast cancers a lot sooner. And I'll tell you, my mom had breast cancer, and she hadn't had a mammogram for several years, and her best friend came over and she said, "We're going to get our mammograms today." And because her friend did that, I think it saved my mom's life. I'm Dr. Mark Jensen, and I'm a plastic surgeon with Revere Health, and I do breast reconstruction for breast cancer. Breast cancer is very common. It's the most common cancer in women, and it's more common in developed countries like America and other developed countries. We don't know why.
So there are a few well-known risk factors for breast cancer. I kind of categorize them into 3 different areas. The first one, and is most common, is time or age. In other words, the older you get, the more probability there is that you could develop a breast cancer. The second major category is, it has to do with the cumulative lifetime exposure of usually a woman's body to unopposed estrogen.
We've had several patients during pregnancy or during breastfeeding develop breast cancer. And those patients went to their doctor and they were diagnosed with cellulitis, which is very common, or mastitis, which is very common during breastfeeding times. But they were put on antibiotics, and the lumps didn't get better, or their mastitis did not improve. And so if you have mastitis or some sort of breast symptom that does not get better in spite of treatment, that's concerning. And then those patients were referred to their doctor for biopsies.
Most breast cancers are driven by estrogen, and this cumulative effect can lead to a longer exposure and a higher risk of getting breast cancer later on. And the third area of, in general, risk factor for breast cancer, I categorize as dealing with your genetics.
If you have a family where, like mine, where Aunt so-and-so had breast cancer, Grandma had breast cancer, Mom had breast cancer, then you need to get in to see your doctor sooner rather than later, just to discuss screening and when screening should be started.
In fact, if you have 1 or 2 first-degree relatives, your risk goes up by 2 to even almost 3 and 4-fold compared to the rest of the population for getting breast cancer. And so those are the 3 most common and general areas for risk factors. It's really hard to prevent yourself from getting older. It's really hard to control your genetics. But there are certain things you can do. You can avoid taking birth control pills, the estrogen-containing birth control pills for years and years at a time. There's other methods.
Every year in October we do a luncheon to honor our breast cancer survivors. And every year it gets bigger and bigger. Every time we do this breast cancer luncheon, I'm overwhelmed as I see these patients years after their diagnosis still doing well, happy, living happy lives. Their color's back, their hair's back, they're happy, they've moved on with their lives. And that's really the goal of breast cancer surgeries to make it so that women can move on with their lives. So get to know your breasts, get to know where you have lumps. If their lumps are stable and they've been there for years, that's generally not a concern. If there's new lumps or things have changed, then that's the concern.